Namaste, and welcome to 10 Minutes with Dr. Marc Halpern. I'm Dr. Marc Halpern, and I'm honored to share this sacred time with each of you. Today, we're going to be talking about integrative Ayurvedic medicine. East meets West. When we talk about integrative medicine, we're really talking about bringing different aspects of medicine together into a holistic perspective. In other words, mixing the best of what Western medicine has with the best of what Ayurvedic medicine has in order to best serve you, the patient. Integrative medicine is beautiful because it doesn't take the perspective that one system is best. It takes the perspective that more than one system, or in this case, both systems, have a lot to contribute to your health and your well-being. And when both of them can be intelligently integrated together, you get the best of both worlds. An Ayurvedic doctor is the person who is best suited to do integrative medicine, integrating Ayurveda with Western medicine. It doesn't mean that an Ayurvedic doctor is a specialist in Western medicine. Not at all. An Ayurvedic doctor has a background in understanding Western medicine, but does not practice Western medicine at all. Instead, they have the deepest understanding and training in Ayurvedic medicine, but they also understand what the Western medical doctor does and has a deep appreciation for what they do. They understand the wide variety of diseases that Western medical doctors are going to see and treat. They understand the value of lab tests and how to interpret those tests. And they're able to take all of that knowledge and bring it together into an appropriate treatment plan. Your Ayurvedic doctor who's practicing integrative Ayurvedic medicine is often going to talk to your Western medical doctor as well, so that the care between the Ayurvedic doctor and the Western medical doctor are seamlessly integrated for your best interest. Now, in integrative Ayurvedic medicine, we want the best of both worlds. What does that really mean? Well, it means that there's a time and a place for Ayurvedic medicine, and there's a time and a place for Western medicine. I've often told my students that if I get into a car accident and I lose my right arm, don't bring me to an Ayurvedic doctor. Bring me to the hospital, get me the best neurosurgeon, sew my arm back on, and then bring me to an Ayurvedic doctor who can maximize the potential of healing from within my body so that I can regain the full use and potential of my arm. In other words, in integrative medicine, we value what both systems of medicine bring to the patient. Surgery is sometimes very important. In fact, drugs, pharmaceutical drugs, are sometimes very important. Herbal medicine is very, very important. Diet and lifestyle are very, very important. Nobody is an expert in every part of medicine. This is why there are different kinds of doctors. You have Ayurvedic doctors, you have Western medical doctors, you have chiropractic doctors, you have doctors of acupuncture or Chinese medicine. Each doctor has their area of expertise. But when doctors are trained to integrate together, who benefits the most? You do. The patient benefits the most. Ayurvedic medicine shines in the management of chronic disease. Western medicine shines in the management of acute disease. This doesn't mean that Ayurvedic medicine can never treat acute disease. It absolutely can. And it doesn't mean that Western medicine can never treat chronic disease. It absolutely can. But each system of medicine shines in different areas. Western medicine treats you from the outside, giving you drugs or surgery in order to influence the physiology of the body. Ayurvedic medicine focuses on the inside, shifting your physiology naturally so that your body reaches its full potential. Why not do both? Why not maximize the potential of the body to heal itself while supporting the body from the outside to also heal itself? I think about our cancer patients here at our clinic. We have a lot of cancer patients who are doing integrative medicine. They are seeing oncologists getting chemotherapy and radiation, and they're utilizing Ayurvedic medicine to minimize the side effects of the chemotherapy and the radiation, and to maximize the potential of their body to fight the cancer itself. The Ayurvedic medicine is going to go on for years working with the body to fight the cancer, whereas the chemotherapy and the radiation are going to be short-term interactions in order to try to eradicate the body of the cancer. Surgery, too, is a short-term interaction to try and eradicate the body of cancer. But without the long-term work that is going to happen from the inside, cancer often returns. So again, this is a beautiful example of how we see integrative Ayurvedic medicine. It means working together with your Western medical professionals to bring about the greatest outcome for you. We have a lot of patients with cancer that are going through integrative Ayurvedic care. We also have a lot of patients with autoimmune disease that are going through integrative Ayurvedic care. Patients with severe forms of arthritis and other kinds of rheumatoid conditions, ulcerative colitis is another one, where sometimes during the acute phases, we need the Western medicine. But during the chronic phases of these autoimmune disorders, we very much need Ayurvedic medicine. And when we bring both of these together intelligently, again, the person who benefits is going to be the patient. All systems of medicine have something very important to add to the conversation, to add to the journey of the patient toward becoming well. Integrative medicine, the best of the East and the best of the West, is something I very strongly believe in. The last thing I want to talk about is the interaction of herbs and drugs, because many of our patients who are doing integrative medicine are taking pharmaceutical drugs, and we want them to take Ayurvedic herbs, and we do have to be careful about how they interact with each other. Herbs are a type of drug, but they tend to be milder. Herbs are a type of drug that tend to work with your body in order to heal you, whereas pharmacological drugs tend to work from outside of your body to sharply influence your physiology and support your healing. Sometimes, however, there are interactions. So a good integrative Ayurvedic doctor is going to do the research to understand what drugs you're taking and how they interact with the herbs, and to then monitor you to make sure that you're not having any negative reactions. This is very important. And your integrative Ayurvedic doctor is able to manage the herbs you're taking and work with your medical doctor to manage the drugs that you're taking so that you're able to be assured of getting the best care possible. This is the journey of integrative medicine, and this is the journey of the Ayurvedic doctor. I want to wish you well on your healing journey. It's not easy to heal yourself. It's not easy to wake up and get a diagnosis that is serious. It's a journey then that we begin to walk. There's no reason to walk that journey alone. Walk it with your healthcare professionals. Your Ayurvedic practitioner is a counselor as well as a doctor. Your Ayurvedic practitioner can support you physically, emotionally, and even spiritually in the sense of working with your consciousness so that you experience deep peace of mind, the kind of peace of mind that influences your physiology. So that as you go through your healing journey, you're able to bring together body, mind, and consciousness so that they're working together to support your physiology. Ayurvedic medicine is holistic, and holism means respecting the body and its interactions with the mind and consciousness. And this too is integrative medicine, integrating together the totality of who we are, body, mind, and consciousness, integrating Ayurvedic medicine with Western medicine to give you the best opportunity to heal yourself. Many blessings to you on your healing journey. Namaste.